My name is Timothy Wong, and I will be the moderator for this panel session today. Now, before we kick off, I just have a few housekeeping rules that I would like to go through with you today. So Spark is the British Council's online festival of creativity. We're celebrating connections and inclusion in our communities and offering a platform for cultural exchange between Hong Kong and the United Kingdom across the arts, education, and the English language. Now, until 23rd of October, there are over 30 free online events across arts, music, dance, education, and digital culture from over 40 creative partners in Hong Kong and the UK. So to learn more and take part, you can visit our website, britishcouncil.hk/spark, and we will post that link in the chat for you. Now, this event is our Growth and Aspiration Arts and Wellbeing in Hong Kong panel session. So we're partnered by a number of Hong Kong and UK organisations who have experience in programs and delivering work using the arts for wellbeing. And this session will run for 90 minutes. So just for those who are still joining us, just to say again, my name is Timothy Wong. I'm the Head of Arts at the British Council in Hong Kong. And for those of you who may not be able to see me so well, I'm a man of Chinese ethnicity, around in their 30s, and I'm wearing green spectacles today. So before we start, just some rules and etiquette for the event. We will be recording this event. Please do not record on your own devices or share on your own devices. And we are really hoping to make this event as accessible as possible. So we will turn on closed captioning and transcription functions. These are optional for you to use as well. And as you may already see, we have a sign language professional assigned to this session. You can pin the sign interpreter, so you can always have them in your view if you would like, and we will post instructions on how to do that in the chat. Also, you should have been sent a link to the British Council's Code of Conduct in the confirmation email for this event. So please do just always be respectful of others and any views expressed in this event. Do mute yourself unless you are talking. Feel free to use the chat function, but obviously please do not post anything offensive in there. And while video on is very welcome, we understand that for many reasons that might be possible or desirable, so it's up to you. I will keep mine on. So without further ado, I'm going to hand over to Jeff Streeter, Director of the British Council in Hong Kong, who's going to talk a little bit about the background of today's event. Over to you, Jeff.
Thank you, Tim. And following on from the way you introduce yourself, I'm white, I'm wearing a light blue shirt, and I'm about twice the age of Tim. So welcome to this panel session. The title, as you know, is Growth and Aspiration, and we're very pleased that this is the opening event of Spark, as Tim has said. The arts play an integral role in the British Council's mission to build connections and understanding between the people of the UK and the rest of the world. They help, that is the arts, to stimulate creative expression and to enrich lives at all times, but particularly during difficult circumstances when our own well-being may come under strain. I understand that some psychologists are predicting that many of us will experience personal growth as a result of the pandemic. This holds out the promise that if we can get through it and help each other to get through it, we will have experienced gains as well as losses. And if so, the arts will surely have a role to play. Indeed, the British Council commissioned research by Professor Sophia Law, published in October 2020, showed that there is significant support in Hong Kong for the idea that the arts can support better well-being, as well as there being an interest in building on the existing work being done here, and demand for new programs from those who do not already use the arts for well-being. This panel and 3 workshops from experienced UK professionals in the next few days are the initial steps towards building connections between UK and Hong Kong in the field and to help support better well-being in our communities. On our panel today, we're pleased to have expert practitioners from both Hong Kong and the UK who will share their experience with you. Professor Sophia Law, already mentioned, art historian, researcher and advocate for the use of arts for well-being from Hong Kong. Amina Hussain, music therapist and principal flautist, Manchester Camerata. Gigi Leung, UK registered art psychotherapist and co-founder of Not a Gallery, based in Hong Kong, and Jenny Regan, director of London Arts in Health Forum from the UK. We hope that this event is an opportunity for you to hear and discuss potential ways that art for well-being practice can be expanded for the benefit of wider society, and how Hong Kong and the UK and organisations here may be able to collaborate in the future. Thank you, and I wish you all a very enjoyable and instructive afternoon, and hand you back over to Tim.
Thanks so much, Jeff, for that introduction, and hello to everyone again who might just have joined us a few moments later. So I'm really delighted to say that now we're going to have a participatory activity for everyone to join in with. If you're able to grab a pen and a piece of paper, please do. We wanted to try and make sure that this event wasn't just talking for the whole 90 minutes. So I'm sure you'll agree that it's a lovely opportunity to get to know each other and engage in a creative activity together. And I'm going to hand over now to So-Yi So, who is going to be our leader for today's session. Over to you.
Okay, good morning to UK, good afternoon to Hong Kong. This is So-Yi from Dongwha Group of Hospital Job Pickup Center Compass for the Elderly. And here you go, we have 2 talented, our seniors artists. This is Miss Cynthia Chen.
How are you today?
And this is Anna Choi.
Hello, good morning. My name is Anna Choi.
Oh, both of you are, and both of them are our creative and talented senior artists. So they are now want to show you some of their artworks. As you can see, these are all their own artwork, and Centennial is one of their favorite topic of our own open studio section. So because they can draw whatever they want without time limit, without boundaries, or also without any specific standards and no pressure. Hope you learn from that. So hey, Cynthia,
Yes.
will you please share with us which one is your favorite and why?
Now, this one, I like this. This is the picture that I draw the Centennial, this drawing. I like the colorful. And also, this is the wave, and just the rope, the trick up. That's why I like this one. Very good. You like it?
Yes, I love it so much.
Thank you.
So, how about Anna? Can you tell us why do you love sand drawing so much?
I like arts and relaxing very well.
Okay, you feel so relaxing during you do some sand drawing. Okay, so that's why we are here. So we are now encouraging you guys or the audience to join us to have the Centennial section right now. Okay. All you need to do is to prepare, as Tim said before, a piece of paper, and then also we need to prepare a pen or pencil on your hands. Also, a relaxing mood, and also we need some. Okay, so maybe it's time for us to start the single section. Okay, so for at the very beginning, maybe it's quite hard to start to draw on an empty paper because you don't know how to. So we first you can draw a big circle on first. Okay, you can draw one or several, just depends on your preference. Then we are now going to share with you some Centennial pattern sample with you guys. Oh, Tim, can you see the Centennial pattern?
Yes.
Okay.
We can see the screen. Thank you.
Great. So that you can just choose which one you like and then draw on in the circle. And also, if you don't like this kind of the pattern, you can just create your own pattern. Like Cynthia, can I share your pattern with them? She has already drawn her own pattern card for her to do some new Centennial painting here.
Thank you so much. And if you were anything like me there, I found that extremely relaxing, actually. So I hope you all had a similar experience there. And thank you for joining us and taking part. So moving on now, I'd like to introduce our first panel speaker for this panel session. Professor Sophia Law, arts historian, academic, and expert in the use of arts for well-being in Hong Kong. Over to Sophia.
Hi, everybody. Yeah, thanks, Jeff. Good morning and good afternoon. I'm honored to start this panel to give a brief report on the research that we did together with my colleagues, Dr. Samson Wong, in 2019. Okay, and next slide, please. Yeah, the research was commissioned by the British Council, and the purpose is to study the receptiveness of local professionals towards the concept and the practices of arts and well-being. Next, please. Yeah, and before we start the research, we need to clarify what we are talking about. What do we mean? What we refer to art and well-being, and to define art in such a context. I would say that art is with a small a. Okay, it is a human behavior. It's a spontaneous expressions through images. So actually art here with a small a is a language written in images, and it applies to all. Next, please. And for well-being, it is a holistic concept. Oh, no, sorry, the previous one. It is a holistic concept, and basically it is human-oriented. and it refers to the quality of life, the development of growth, social bonding, and also human connections. And to have well-being, we can define it as a kind of having an ability to care and be cared. Next, please. And in order to use arts to promote well-being, I would say that the implementation, I would call it as a kind of art facilitation in order to distinguish it to art therapy. And by art facilitation, we mean we are using art as a means, as a tools, as a platform to promote developmental growth, to improve or to enhance social bonding, and also to promote human connections, which will lead to well-being. Next, please. And in this research project, it is a very short project, it's 4 months. The objective is to, first of all, to investigate the level of understanding and perceptions of the uses of art in local Hong Kong situations. And we will study the current practices and also the need, the demand, and any difficulty or challenges, and also to analyze the government and non-government policy, and try to identify, is there any potential approach to, improve or later for future opportunities. Next, please. Next slide, please. Yeah, thank you. Now, because it's a very short research, so it is not a general survey, but rather we focused on local professionals. And we refer to social services, healthcare, and education. Next, please. And the service target, we are targeting at those social service for elders and also youth at risk, and also people or person with different abilities. Next, please. Yeah. And in this research, we try to include as many stakeholders as possible. So we try to include artists, social workers, teachers, health professionals, and administrators. And also we set a questionnaire, and we got over 300 responses. And we also conducted 26 in-depth interviews. Next, please. And to highlight the whole report, you can click online. And here I just give some highlights. And in the over 300 responses, 999 said they are using arts. These are professional, local professionals. And over 65% of the respondents said that they believe there is a close relationship and between us and human being. And but however, there are over 30% of the professionals who are using art enjoy art making themselves less than once a month. And also over 20% of them, those art programs are conducted by unspecialized staff, or in some cases without any training. Okay, they just use art. And for the requirement to improve the uses of art, most of them highlight, awareness and also resources are the greatest difficulty or challenge. Next, please. Yeah, and in the interview, the 26 interviewed, the result is rather varied in terms both of the perspective and the quality of their services. But however, they all committed to use arts to achieve specific goals. In some case, like youth promoting developmental growth, and in elders quality of life. And all of them have no proper documentation of all those programs, and also there's no study, no guideline. And in one thing I find amazing is shocking, not amazing, is there is no sharing even within the same institutions. Okay, there is no sharing among the professional on their experience, rather the failure or the success of those art programs. And there are limited theoretical understanding between why we use art, It seems to be just, it's trendy, or it seems like, useful. That's why. But no in-depth understanding between the relationship between art and well-being. And also there are quite a wrong assumption or expectations towards the outcome. Next, please. Next slide. Ali, next slide, please.
Can you see the screen?
No, it's still the interviews. Oh yeah. Thank you. Thanks, Ali. Yeah. There are quite a few wrong expectations, both from the policymaker, donors, management, senior, high level. Obviously, the outcomes are often measured by countable outputs. Okay, and they seek for larger numbers of participants, and they for the outcome they focused on talents, the skill, and also many of the program focus on the final exhibition. It seems to be the exhibition is one of the greatest outcome of the program, and this kind of approach actually is disregarding a more impactful approach, which should be focused on less participant but more in-depth or lengthy program, a longer period of program rather than short program. Next, please. And for the government, in the local situations, although there are quite a few funding by the government, but however, those are mostly funding scheme rather than policy paper. And we observe that we find that there's a little awareness of the empowering impact of arts on the well-being. And also, institutional setting discourage interprofessional collaboration. And I find this is rather, I don't think it's unique, but the common situation in Hong Kong is there's no interprofessional collaboration. That's why the artists, do not understand well about the social welfare, and the social worker do not really, collaborate with great understanding with the artists. And the rigid structural setting of the departments make things very complicated. Yeah, and later, if we have time, we can have case studies to talk more about it. Okay, thank you. And next slide. Next. Not working. Yeah, thank you. And for the challenge, basically is the resources and awareness. And for the resources, both in terms of funding and also manpower. Another thing is the space and venue. And also training is a major problem. And for the awareness, all the the public services, government, donors, policymaker, we find there should be more understanding or awareness towards the vision of arts and well-being, and also the implementations. And we, as I just mentioned, I think a cross-disciplinary sharing and collaboration will be very, very useful. Okay, next, please. So some conclusive findings. So we find that in Hong Kong, actually many professionals are using art, and they are ready and willing to learn more about how to use art to promote well-being in their service. But however, there lacks a clear roadmap for a consensus on the uses of art to promote well-being, and also the vision of art and well-being, the vision of the art with a small letter A, needs more debate and discussions. And there is a lacking of platform for sharing of the knowledge, experience, and reflections, and which will be very, very useful. Next, please. So looking ahead or looking forward to, we are hoping that we can do more for educations. I mean, public lectures, interprofessional exchange ideas, sharing discussion towards policymaker, and also training is very, very important and high demand in Hong Kong, and also interprofessional sharing and support a database or a resource center will be something great and that we are looking forward to. Yeah, next, please. So I think more or less that's done. Yeah, thank you. Yeah, I look forward to the discussion later.
Thank you very much for that really insightful presentation. Thank you. And I think that platform that you mentioned towards the end of your presentation there, yes, we really hope that this, not just this session, but the series of workshops also that will follow this over the next few days will just be the start of that platform and some collaborations between UK and Hong Kong partners. So thank you very much, Sophia. Without further ado, I want to hand over now to our next panelist from the UK. Jenny, are you with us on the call? Jenny Reagan.
Yes. Sorry, I've had
Hi,
lots
Jenny.
of internet. Hello. I've had lots of internet problems this morning. We've got gales blowing here, so apologies. Yeah, it's really lovely to be here with you all. Thank you for having me. I'm going to share, hopefully, a quick presentation. Okay, thank you. So I am the Director of London Arts and Health. We're a charity that have been going for 20 years, actually. So I think lots of what's been talked about today is kind of where we were in the UK 20 years ago. The charity started out as a very small group of arts practitioners, mainly working in hospitals. So it was very much about kind of hospital-based arts. And we obviously still have a very strong group of people who work in hospitals now and do some fantastic work. Over the 20 years, arts and health has gone, thankfully, from being very much at the edge of kind of healthcare and arts, and has moved much more into the mainstream. So as a charity, what we do, we kind of, again, what you've talked about here, I think what's needed in Hong Kong, we work to bridge the gap between the arts sector and the health sector. And a lot of that is around kind of shared language, ensuring that people talk to each other even, because there's a really different way of measuring what health is and what kind of good quality looks like. And they don't often match up between the kind of arts and health sectors. So one of the things we do is make sure that people talk to each other, and we kind of bring events together. We hold roundtables. We offer training. Arts and health still, although it's a fairly mature sector now in the UK, there's still very few kind of professional training courses for arts and health. They're just beginning to kind of introduce university courses which deal specifically with arts and health, which is fantastic. But up until this point, it's been very hard for people to actually gain skills and access. So that's something we offer. We talk to the government, we talk to the NHS. It's all very well offering fantastic arts activities, but unless it's been embraced by the people who can pay for it, it's not, no good for most people, really. We share information and resources, and we hold a festival every year which kind of celebrates creativity and well-being, and I'll go back to that in a while. So I guess for many, the shift in the UK came around after the all-party parliamentary group on arts and health, and it published a report, I think 5 years ago now, maybe it's 6, called Creative Health, which really showed exactly the kind of tangible benefits of health, of arts and health and quality of life. We all know that the kind of arts, creativity, and even accessing the arts are fantastic for people's well-being. And we know from cradle to grave that, there are certain things that promote well-being, there are things that promote recovery. And particularly now, in the kind of economic and pretty awful situation we find ourselves in across the world. Arts and health, we know, can now offer a really kind of a good value choice for practitioners when they're looking to improve health in people, and when they're looking to aid recovery times. And it's something that's been slowly embraced by the NHS, and you can see from this, this was the report done, which actually broke down lots of the kind of money, basically, how much money can be saved by people taking part in arts and health activity. And again, it's not just around taking part in the arts and activity. I think something that was really clear in the presentation, the last presentation, was the fact that it's not the product, it's the taking part, and that's become I think we've overcome that barrier. But you know, high quality can still mean high quality, even if it's not a masterpiece in people's eyes. So it's kind of coming around to the idea that actually it's the participation, it's the connection that is the real kind of power here. And we know that when people have taken part in the arts, then other things improve in their lives. You know, things like eating better, exercising more, becoming more connected to their community and others around them. So we have had a lot of we've done a lot of research in this country, and it's just beginning to kind of be recognised as something that can really help the NHS when it's on its feet at the moment. So yeah, in the space of just a generation, there's been a significant shift really from medical model. And one thing we really encourage to see is a holistic look at healthcare and holistic look at how we can treat people. You know, we know that mental health is a terrible, debilitating kind of, I say disease, anyway, it is a disease. And it's just, again, we're beginning to see parity in terms of how it's perceived, not necessarily in terms of how it's treated. You know, in the UK, mental health is still very much the Cinderella of services. However, we know that arts and health, we know that there's many activities that can really support mental health and can bring people together again. And also the management of chronic and long-term conditions. We're seeing in the UK a massive increase in kind of people over a certain age, which the health burden is kind of becoming very heavy at the top and kind of not so yeah, it's unbalanced basically. So we're seeing a lot more kind of long-term conditions, and that's taking up a lot more budgets. But yeah, the creative health, the arts of art for health and wellbeing is a fantastic report that really, I think, changed the way we think about arts and health in this country. And I can put a link into it afterwards. As well as the NHS, funders have started to realise the importance of arts and health. We're funded by Arts Council England, and in their latest strategy, they've really put arts and health, or arts, the importance of arts and health and wellbeing right at the heart of the agenda. And they are hoping that even the kind of arts organisation and cultural organisations that have never touched upon health before will be including that going forward in their delivery. And we've seen it a lot during COVID, actually. We've seen a lot of larger cultural organisations really kind of dipping their toe into wellbeing in response to COVID. The big buzzword at the moment in the UK is social prescribing. And it's something, I can see lots of nods there. It's something that has been happening for many, many years in many different ways, but it's become formalised, I think, in this country. So social prescribing is where somebody can visit their doctor, and rather than be given, well, alongside or instead of medication, will be offered an activity. Our role as a charity has been to really make sure that cultural social prescribing does not get forgotten. It's all too easy when somebody presents with a particular health problem to deal, first of all, just with the social issues. So with the money, with the budgeting, with exercise. But again, we know the power of cultural social prescribing, and in terms of enabling people to live longer lives and live better lives. We know there is that power in kind of cultural social prescribing, so we're very much trying to ensure that it stays on the agenda. We embrace social prescribing. It's a fantastic thing to happen. It's looking at Again, holistic healthcare, no one size fits all. It's using local partners, it's using grassroots organisations. However, at the moment, there is very little funding for the delivery of social prescribing. And there is also a fair few issues around the quality. We know that people are kind of beginning to offer social prescribing and not necessarily having the kind of the background or the skills to be able to kind of actually deal in a medical setting. So there are definitely issues, but on the whole, it's something that that we embrace. And this, in the UK, we now have an organisation called the National Academy for Social Prescribers. And they are mainly focusing on training link workers, who are the link between the GP and the patient. And we also have something called the Creative Health Centre, which again, going back to the previous presentation, is bringing together all the research and all the knowledge that we know into one place so that it can be shared and it can be used more widely. So yeah, we as a charity, we have put together some resources around cultural social prescribing. So again, we can put them in the link, and it's just really to try and make sure that both sides know what they're talking about. So this is for doctors, this is for link workers, and it's also for artists. I'm hopefully going to show you a very quick film. I say hopefully.
Last year, I contracted COVID-19. I was really unwell and ended up in hospital twice. Both times felt like a near-death experience. But each time, something inside me said, keep going, you're not done yet. Having coronavirus has changed my life. The lasting effects are not just physical, they are mental and emotional too. Before being ill, I was fit. I would run, I would play with my kids. Afterwards, I felt breathless, anxious and overwhelmed. To speak, to breathe, we take it for granted. My doctors recommended me for a new program from the English National Opera called Breathe. The weekly program lasted an hour and we sang lullabies and learned exercises to calm my breathlessness, supported by online videos and resources. It's more than that though. Meeting people who have gone through something similar and learning in a creative environment has helped me on my journey to recovery. This program has been like a breath of fresh air for me. I have a long way to go, but arts and culture on prescription.
So I think that's a really perfect example of all the things I've talked about, really. So how arts and health is dealing with the kind of most pressing issues at the moment. Obviously, in the UK, COVID is just rampant, really, and long COVID has become a huge issue for many people. So it's looking at how a kind of a larger organisation, so the English National Opera, who've never really done arts and health before, have kind of taken on the health issue and really done brilliant things with it. And they're now on their second, they're actually beginning to scale up what they're doing so they can reach more people. There's very few, there are very few kind of treatments for long COVID at the moment. So it's kind of something that's taking the place, but is also sitting alongside traditional health, which it's you know, his story is a beautiful one. He would never have taken part in opera before, but it's really helped him get better and it's really helped him connect with other people. Just finally, one of the main things we do is a Creativity and Wellbeing Week. This will be happening next May. So this is this year's week. It's a national event, but actually because of, funnily enough, because of lockdown and because of the digital kind of capacity, it went global last year. So we actually had a number of countries that took part digitally. So again, if anyone's interested in taking part in Creativity and Wellbeing Week next year, I'll put my details at the end, or we can put them in the. But basically, it's a week of celebration around arts and health, and it's about taking arts and health outside to kind of other communities, and just really celebrating what's happening as well as a kind of a big umbrella festival. And these are all our websites, but I can make sure, I think, that this is all available for you. So these are all the things we do. Yeah, please do get in touch if there's anything you want to talk about or ask questions. Thank you. I'll stop sharing.
Thank you so much, Jenny. That was a really informative and enlightening presentation. So next up, our next panelist is Gigi Leung from Hong Kong. And I'm going to hand straight over to you, Gigi. Jenny, I think your presentation is still shared.
I'm trying to unshare. How do I unshare?
So you just click the white box.
Yeah, sorry. No.
Thanks.
Is that gone? Brilliant.
And Gigi, we can see your screen now. You're on mute, just in case you hadn't realized.
Yeah, can you see my screen right now? Can you hear me?
We can hear you and we can see you.
And you can't see my screen.
We can see your screen.
1 second. Okay.
That's great.
You can see the screen right now. The presentation.
Yes.
Okay, good.
Yes.
So I will try to control to present everything within 10 minutes. And good morning in the UK, and good afternoon from Hong Kong. I'm Gigi. I'm trained in goldsmith in the UK, and I really want to try to bring back what I've learned from the UK and try to transform into something that fits into Hong Kong's environment. So here we go. I'm trained as an art psychotherapist in the goldsmith, and my bachelor degree is creative media. So I study computational arts and some phenomenology as well. However, when I finished my master's degree, and before I returned back to Hong Kong, I was kind of stuck because there is, I give you some background information that is, in Hong Kong, art psychotherapist is not legally registered. So my license is valid in the UK, but in Hong Kong, just like the NHS, there is no such registration system. So that's why not many jobs in Hong Kong is available. So that's why I was quite confused when I returned back to Hong Kong in 2018. Coincidentally, one of my friends, Bon, he is a documentary director, and he suggested maybe we can start up some community projects that maybe we can collaborate and maybe some synergy can be created. So that's why we found Not a Gallery in 2018. As I mentioned, he's a documentary director. So we focus on documentaries, and I am an art psychotherapist, so I provide mental health services in Hong Kong. My partner, Bon, he focused on rare disease patients, the elderly services, also some stories about the underprivileged school kids in Hong Kong. However, today's theme is about art and well-being, so that's why I will focus a little bit more about the mental health services, what we have been providing under Not a Gallery. In 2018, we founded our company, and as you can see, our stage is extremely small. And these data, the cutoff is the June of 2021. We have been providing service to 67 individual clients, and we have organized some small and medium-sized groups also organize some large groups for private corporates, schools, and some social enterprises as well. And the following slides, I will focus a little bit more about the individual clients. So this is our space with some art material, some toys, with a centre. Yeah, whenever I have sessions, I would draw down the curtains and display a board outside the space and showing that, oh, art therapy in progress, and hope the people nearby can keep their volume down. So 43 square feet studio is located in the local shopping mall. So it is in the basement. And what we can contain in the space is a bookshelf with different kinds of art materials, also some materials hang up on the wall, and a table and 2 chairs. That's it. Let me give you a bigger image. So how big is 43 square feet? Oh yeah. So this is how we try to locate our studio in a community space instead of up in some community commercial buildings or industrial areas. As Sophia mentioned, resources is very limited in Hong Kong, no matter if the funding or the rent in Hong Kong is extremely crazy. So we are a new start company, and we try to, we have been thinking how we can make mental health visible. So that's why we located our local studios in the local shopping mall. Very interesting, some grannies or some uncles pass by when they found the wording, oh, art therapy is really new in Hong Kong, and they will ask, oh, can you read my mind? Are you a detector and you can understand immediately what I'm thinking right now? Or even there is one old lady, she's a senior lady, she brought along the drawing of her grandson, and she tried to invite me to interpret and analyze what her grandson is thinking about. At least it is some starting point of our conversations, so I can explain what art therapy exactly, how it works, and maybe these in the neighborhood, more people can have a better image of how art therapy is working. So 43 square feet is approximately 3 sides of the bathroom. Not big, but this is as much we can provide. But in this space, throughout these 3 years, we have been serving 67 clients, and following are some data analysis of our clients. Most of my clients are females, and very interestingly, most of the people might think, oh, because my space is located in a local area, and maybe I serve the neighborhood nearby, but actually it's not. And my studio is located in Hong Kong Island, but my clients is not the majority of the client group. Most of them have to travel maybe for an hour, come to my studios, or they live really far, and then they found out, oh, your space is very cozy and in the community, very ungranted, and makes them feel comfortable and belongs to. So that's why they are willing to travel long hours to come to my space. So the age range was quite surprising for me, and almost 1/3 of the clients are the students and under 18, and even maybe some of them are brought by their parents, and maybe they are referred by the school teachers or school social workers, or the parents heard some radios or search online, maybe art therapy can help their kids. And I have few inquiries that are the kids just type art therapy online, and they found our website, and then they call me and ask, oh, can I see you for an assessment? So the findings was quite surprising, how Hong Kong students are desperately need the psychotherapy service. And because art therapy is a means of early intervention, so that's why more than half of my clients are without any psychosis diagnosis. They are temporarily feeling some emotional distress, or maybe they are going through divorce, or the pressure of being a caregiver, or different kinds of pressure from the family, or the cultural, or even political pressures. So that's why they come to see me and try to sort out before the situation gets worse. So that's why half of my clients see me every 2 times a month. And we have 2 different types of sliding scale. We have market price and we have sliding scale. But the most, I would say something I can in control, that is the price of the charging fee, because I'm not NGOs, and I don't have to report to the government how I spend my resources. So that's why I can handle the charging fee flexible. More than 50% of my clients are enjoying the sliding scale, and I will not check their income, as I believe on the system can work well in Hong Kong. And I think Hong Kong people are willing to help those underprivileged Hong Kong people. So that's why whenever I have new inquiries, I will show them, I will let them know my charging scale, and quite a few of them will surprise, oh, you are willing to let me know your sliding scale, but I'm affordable for the market price, so I can help other people. Because in Hong Kong, the private services are really expensive. It can be quick, it can be splendid, but cost a lot of money as well. But the public services take so much time, even though the price is low. Let me give you some figures about how it's Hong Kong situation. Because if in Hong Kong's NHS system, you want to meet a clinical psychologist, you have to go through a psychiatry specialist before meeting a CP. But for those stable cases, on average, it takes weeks to go through. So the longest one, it can be almost 1.5 years, and the number is growing longer and longer, bigger and bigger, because the resources in Hong Kong is really limited. So that's why when I found Nordic area, I think, can we be something that's happening in between? And eventually, we are growing. In December 2020, we started another shop. So that is selling books, documentaries, organizing workshops and screenings. If you are interested, you can scan the QR code to follow us on Facebook and Instagram. In this space, we organize different types of community talks about community buildings, and we organize listening space. So that is a community project curated by me. I, as an art psychotherapist, I was based in there, and people, whenever in the community, you can come over and have a chat together, and for free. And we have art programs for making different types of drawings and paintings in the space. And we have designed a little like a corner so that we can share secrets with different strangers, so as to promote. We can share stories and have better imaginations of the strangers nearby. So this is the last project I want to share, and this is the ongoing project, and Dr. Sophia is one of our consultants as well. And this project is named The Forgotten O, and we designed a kit set for the parents and children. So this is a 18-month project, and we recruited almost 15 volunteers, and they trained by different professional parties, social workers, scholars, and psychotherapists. And they attend the sharings of different families. And this is the book. We designed it and open for sale as well. We created 2 characters so as to guide the kids to understand the emotional changes journey of Jamie of searching for his friend's O. So this is a co-reading material for both caregiver and the children for the age of 4 to 10. And the design is included different types of sensory integration. For example, rubbing over the thermal changing cloth, just like here. And we have one design guidebook for the caregiver as well. So this project is to decentralize the mental health service, because for the past decade, no matter if the donor or the government really want to try different types of ways to promote mental health. However, we can never see the banners of psychiatrists or psychotherapists in the community. So that's why we are thinking, how can we promote a little bit more the needs or different understanding of mental health, and we will continue creating different types of art and well-being programs by using art. So thank you. If you are interested in Art Gallery and for those projects I just mentioned, you are feel free to scan the QR code. This is our website, this is our Facebook, and this is our Instagram. So stay in touch, and thank you, everyone.
Thank you very much, Gigi. That's a great presentation there. And I think for those of you who've been with us from the start, hopefully what you've got a sense of with the first 2 presentations is a bit of an overall view of some of the environments and the context in both the UK and Hong Kong. And Gigi has given us a really great example of some of the work being done in Hong Kong. But finally now, I want to hand over to Amina Hussain, who's going to talk about an example of some of the work being done in the UK with Manchester Camerata.
Great, thank you, Tim. Hello to everyone. Good morning from Manchester in the UK, and good afternoon to all of you in Hong Kong. It's amazing to be here, so thank you for having us. Just lovely to be able to share our work, and fantastic to hear the previous panel presentations as well. It's absolutely incredible. So I'll just introduce myself first of all, once the presentation is up. If we could have the second slide, please. You can see our glorious logo there, just to get yours started. Thank you, that's perfect. So as you can see, my name is Amina Hussain, and I am principal flute of the Manchester Camerata Orchestra, and have been for, I don't know how many years, maybe 15 years or something like that, I'm not quite sure. But I am also a qualified music therapist registered with the HCPC in the UK, which is the Healthcare Professions Council. And I am actually resident within the orchestra and operating as a music therapist within the orchestra, so taking a lead role along with other music therapists on this particular programme. In this photo that you can see, one of our workshops in action that is happening very recently, sort of post-COVID. We've been, in the last month, been able to resume our face-to-face sessions, which is quite amazing. And this building is Manchester Camerata's new home from earlier this year. It's an area of Manchester called Gorton, and this is their monastery, which is, as you can see, very grand, and it's a lovely space to be in. So it's very, very nice to be running sessions there. If I could have the next slide, please. Thank you. This is just a short video that I felt would be just really useful, just to get a flavour very instantly of what our work is, and hear some of our participants speaking about their experiences of music and mind. These are all wonderful people in the community and in care settings living with dementia. And one of our music therapists, Brigitte, also speaks very briefly. So if we can watch this now, please.
The idea is to pair up a music therapist like myself with one of the orchestral musicians from the Manchester Camerata, and deliver interactive music making sessions.
We've been coming here for the past 8 weeks or so, and it has helped us a lot as a couple. It gives me time to spend with Patrick.
The more they are able to join in with the music, the more they reconnect with themselves or connect with the people in the room, become aware of each other, and feel this lovely sense of group music making.
Thank you very much. Just about to start again. That's quite exciting. I love watching that video, as there's so many people on there that we have connections with. It's just very exciting to see it. It's very nice. Just to give you a bit of brief background about what Music in Mind is, in addition to that video, Music in Mind started around 10 years ago as a pilot project at a point during Manchester Camerata's sort of slight change in strategy and moving into arts and health and well-being. And we hadn't worked with older people up until that point. We typically worked with younger people in schools and teenagers doing crossover education projects. So it was very exciting to start something new and to really explore arts and health and well-being in a different context. The music therapy led program, which is for people living with dementia, but it also is very much for professional carers and for family members who are carers in the community as well. We very sort of strongly believe in the ripple effect of co-creative music making, and we found it to be incredibly effective so far. As you can see on the slide, so far since we began the program, we have reached more than 6,500 people, which is an incredible number. But that is over 10 years, and it has been challenging over that time to build up to the point that we're at right now. We typically always do group-based work. The pathology of dementia does mean that the ability to relate to people can disappear. The different types of dementia impact people differently. So our approach is to use group work with a premise that we start to build resilience and provide a platform in which people can actually begin again to relate to other people and to relate to themselves as well, because that can also disappear for the people with more advanced dementia. And we typically use improvisation, music improvisation as well, as a predominant feature of our sessions. And the reason we do this is because it's a very flexible approach. It can accommodate all different types and abilities of contribution within the session, and all of that can happen simultaneously or separately. So there are lots of different layers to that approach, which have been proven to be incredibly effective and useful in terms of engagement and sustainability through a music making project. The project typically is Music in Mind is delivered by members of the orchestra. So various different people, different instruments. We have anything from violin to tuba to flute to clarinet, all the possibilities. And each musician is paired up with a music therapist. That would either be myself or could be an external music therapist who's invited in to join the program. And in fact, because when I first started Music in Mind 10 years ago, I was a support musician from the orchestra. But explicitly due to taking part in Music in Mind, I became very interested in music therapy and retrained and became a music therapist. So I now hold a dual role within the orchestra, which is really nice. And finally, the whole project has been developed through long-term research in partnership with the University of Manchester. There are ongoing research projects. We are about to embark on a new 18-month evaluation project as well, which we hope basically over time we continue to clinically evidence the work that we do, because we recognise how much impact that has in terms of gaining funding in the future to continue our projects, and so that they can become more long-term and more sustainable. Could I have the next slide? Thank you very much. As an extension of Music in Mind live in-person sessions, during the pandemic last year in July, we developed a resource, an extension of Music in Mind live known as Music in Mind Remote, which came about as a result of basically never being able to access care homes as we had done previously due to coronavirus. We had many discussions amongst ourselves about the abrupt ending of those live sessions due to safety and safeguarding, and what we could do during the pandemic to try to alleviate situations in the care settings. Obviously, there were months when we simply didn't have access to anybody at all. So we used that time to create an online resource based on Music in Mind Live, which aims not so much to for us to have contact with people with dementia in care settings, but for us to have contact with the care professionals who could then be the point of contact with their residents in their homes. We felt that doing digital Zoom sessions with people living with dementia under such duress during the pandemic last year was simply too much to ask anybody at any time. So we focused on this, and the programme is delivered again by the same team of people from the orchestra. So we co-created this product ourselves. As you can see from the images on the screen, these are some stills from the website that we have. So we've created a website, which is the resource, which has training, foundations, videos that give examples of Music in Mind in action that our team created. So it doesn't involve participants. And I don't know if you can see, but we're very, very spaced apart in that hall on that particular image. That was at the height of social distancing, when we needed 3 meters between each of us and a maximum number on the stage. There's a lovely picture of Andrea against a brick wall, and she's our percussion specialist. And there are videos where she introduces the care staff to instruments and how to get the best out of them. There's no right and wrong, but if you want to play it in a certain way, this is what you'll get. If you play it in a different way, this is what you'll get. So having that flexibility. Next slide, please. Thank you. The programme for Music in Mind Remote is structured just as it says on this slide. So there's weekly group training sessions and weekly one-to-one training sessions. These sessions for care staff focus on the music activities that we would use, and we make those music activities accessible for non-musicians, untrained musicians. It's completely possible, we've found, to provide training in elements of the work that we do correctly and safely, so that it's delivered with the best possible intentions. Warm-ups, how to use the online resource. We provide instrument packs and iPads, there are instruction videos. All of that is an incredible resource, not just for non-musicians, but also for other musicians who wish to take part in our training in the future as well. The iPads also provide space on the website via the iPads. There's a forum for professional care staff to exchange their ideas and their challenges that they're facing during the music sessions that they deliver now in the homes. And it's been an incredibly useful resource for us as well, because we've been able to monitor is the wrong word, but we've been able to kind of see the progression and the development that's needed, and see the gaps, and basically work on providing a really cohesive experience for everybody involved. Next slide, please. That's okay. Thank you. So far, through Music in Mind Remote, 20 carers are now trained and delivering their own versions of Music in Mind workshops for people living with dementia. They regularly check in with us. We offer support and guidance. And again, they have the website as a resource to access, and we can access any issues that they're facing via that as well, which also in turn means that over 200 residents have continued to receive the benefits of Music in Mind through their carers during the pandemic. One thing I'd like to say about that is, again, the ripple effect is taking place. We're providing a legacy package effectively for when live projects are unable to continue beyond their funding or beyond the resources. That we have a very strong online resource implemented in place, which aids the very successful continuation of the project, regardless of whether we're in attendance or not, which is incredible, I think. All of these benefits we've found have been evidence to increased social interaction with other residents and care staff as well. In fact, increased activity levels outside of our Music in Mind sessions. The transferable skills from the approaches that we take that can exist outside of a co-creative music activity is very strong, very palpable, and so we do focus on that quite a lot. Where it says music and movement, that's greater interaction in music activity, whether that's listening to music again for the first time again in years, or practical engagement, and movement in terms of mobility and motility. There's a greater sense of well-being. We've had many examples of people on reduced medication as a result of taking part in a creative process with our programme, and generally increased musical interactions within the sessions and confidence to express themselves through music and to relate to one another. So that's a very brief summary. I should just point out the asterisk at the bottom of Dr. Heidi Kuljonen's evaluations from 2020, where we can probably post a link somewhere, I think, to those if you'd like to read them, where she had monitored about 2 years worth of our projects to see what the impacts and benefits were, which these have come from. And I think I should probably end it there. I think that's it. Thank you very much.
Thank you, Amina. Thank you very much indeed. So we are just about at the end of our allotted time for this event. But what I would say, though, is that if the panelists are happy to, perhaps we could just take any questions for a few more minutes if any of the audience are able to stay with us and have questions. If there are no questions from the audience, I know I definitely have a few that I'd like to ask. So I would just say and I can follow this up with all the panelists offline afterwards, but if the panelists are happy to share contact details with the people who've registered for this event, then I can send that round to everyone by email for sure.
Thank you.
And
Thank you very much.
And I think one area that you just picked up on there that I wanted to put to the panelists is that topic of evidence and talking about what the result of work like this is, because if we're not in arts and wellbeing work, if the final product is not a big performance or whatever, or a showcase, but actually it's participation, and that's a word that came up a lot I think in all of the presentations. I was wondering whether any of the panelists might be able to share some of their experience about how do you evidence that for funders, for policymakers, when people might have that different mentality. So they might be looking, well, what's the final result? What's the kind of quantitative? How many people is this reaching? When in fact, actually with participatory work, those aren't really the headlines that you're working with. I was wondering whether any of the panelists had an opinion on that. I think Amina, you've got your hand up.
I did it in the traditional way, didn't I? I just stuck my hand up. Child in the classroom. It's an incredibly difficult question, and it's one that we all face all the time in terms of trying to get funding and evidence our work. As it happens at Camerata, my sense of time has gone since the pandemic has happened. I've got no concept of months or years, but maybe 3 or 4 years ago, maybe slightly longer, we had a lady called Dr. Robin Dowland who began to evaluate our work, all of our Music in Mind sessions over a period of time, with the premise that she was looking at the in the moment experience. So we were trying to basically adapt the evaluation criteria to suit the work that we were doing. And we had some good success with that. So I think part of the conversation is considering that evaluation and evidencing tools out there are actually just much too difficult and not designed for the kind of work that we do. So I think it's really important to consider what your practice is, how it works, and how to create evaluation tools around that work that is going to more than adequately demonstrate the efficacy of what you're doing. I think that's a big thing for me and for us. Perhaps Sophia can comment on that a bit better than I think.
Thank you. Actually, I was trying to ask, the research. Well, it seems that to promote arts and well-being, I think research is a very, very important element to encourage or to ask the policymaker to make policy heading that way, right? Otherwise, and in my experience, I've been doing research on art and well-being since 10 years ago. And as Amina said, it's very, very difficult to prove, right? So we are targeting at qualitative evaluations. And for my project, usually I start with a small numbers, okay? But if, for example, SEN, I start with 25, but I run 2 years program, so I have 50. And for qualitative, I mean each section we have very detailed documentation, and that documentation I have a research assistant who is involved throughout the whole project. So she understands, she recognizes all the audience, the participants in the group, and then to document all the observation. When I ask her or him to note down, not her comment, not her feelings, but fact and data. For example, a student kicked a chair during the section in the beginning of the session, right at the beginning of the 5 minutes. And in my research on SEN, the 1 year project, one observation is, for example, to start with, those students are very cooperative and very challenging the artist, challenging the social worker. They speak, foul language, and also they fight, and then they always raise hand, going to toilet, drinking, whatever, okay? But along the way, these behavior minimized. They were very, very engaged in that creativity, and there's no more going to toilet, drinking or fighting. And also more collaborative, helping each other. And also in my research, I try to include small amounts of quantitative. So each section, I have 3 indicators, and I ask the social worker, the art therapist, the research assistant. Usually the social worker will be 2, okay? So I have 4 readings for each participant, for each indicator. And then for the indicator, it is closely related to what we are looking for. For example, engagement, right? For SEN, I'm trying to see the attention span. Would it be improved? Okay, so engagement is one thing. Another one, social connection and social collaborations, because those SEN students are usually very rebellious, right? And so I have a cooperation, the indicator. And also another indicator is very useful is expressiveness. And for the expressiveness, it can be interpreted by their artworks, of course, and also the process of art making. For example, they throw paints, okay, they kick, and when they play drums, they hit, okay, or they play, you know, quietly. All these had to be documented. So there's a huge work. And for me, all my project, each 4 section, we have a core working team. The core working team meeting means the artist or art therapist, the social worker usually is 2, and then my research assistant and me. So at least 5 of us, we sit together, we look at each participant, each section, and the artwork or the work they produce, okay? Every 4 sections, we have this kind of meeting. And I find those meetings are very, very variable because we exchange our interprofessional expertise. I learn a lot from my social worker, right? And they learn a lot from the art therapist or artist. And my first experience is, you know, the communication between artist and social worker is very, very difficult because they speak different languages. And for me, I'm just in the middle. Okay, I'm trying to bridge them and try to explain what's happening, why it works. Because for the artists, they say it works, it just works. Okay, and don't ask me why, and something like this. And so I think we still need a lot of, you know, insight or sharings and idea exchange and discussions on how we do research. But it seems to me that research is definitely a very, very important thing to persuade our policymaker, our donor, to show them, you know, and in my case, especially my case on child abuse, it's been very, very successful because one of the donors has been funding our project for over 7 years because she witnessed the changes. Yeah, and those outcomes are, you know, not just by my documentation and my report, but also from social worker. Because, for example, the social worker told the donor that they learn a new tools, which improve their service. They have never thought of using art, but then now suddenly something, you know, prop in, and it enriched their whole profession, and this touched the donor. And she finds this is something meaningful to do it. So I think we need a lot, but a huge work, I can say. Okay, yeah, yeah. Maybe let's see whether, you know, Jenny have any comment.
Not too much to add. I mean, I think you've really hit the nail on the head there. I think from our point of view, yeah, qualitative data is always, you know, we collect a lot of case studies, and for some funders that can be enough impact, obviously combined with quantitative as well. Our main focus as well at the moment in terms of getting funding is actually trying to get funding from commissioners and from the NHS. So it's all about money saving. Unfortunately, it's not necessarily about, I mean, it is about the kind of experience and how well it works, but it's also, you know, we're focusing very much on how much money can be saved for the NHS. You know, if we know, for example, people visit their doctors less if they're involved in social prescribing, it saves the NHS money. So yeah, it doesn't fit very well with the arts world somehow, but it's necessary. But yeah, I think from what we really encourage is case studies, and the national the Culture, Health and Wellbeing Alliance, and I can again share these, did a fantastic collection of case studies during COVID. And it was a really good kind of impact statement on kind of what people were doing during lockdown and how they help people. So it's worth looking at that if you want to see how kind of gathering evidence in that way can be used.
Thank you, Jenny. I think we're almost running out of time, so it's almost time for us to finish. But Amina, I think you had your hand up as well and wanted to come in.
Yes, I'm sorry, I'll be very, very brief. Fantastic comments from Sophia and Jenny. Thank you. I'll be very brief just to add to that I think those interprofessional conversations are absolutely crucial. I think as arts practitioners, as arts facilitators, we go in and we know we can do our job. We know it has benefits. We know that it has an impact. But we have to persuade other people in the same department of the same things. As a music therapist, I'm trained to some degree in being able to speak in particular ways with shared language, with multidisciplinary teams and interprofessionally. That is, I feel, a lot harder for arts facilitators who are very good at their job, so good at your job, but don't necessarily have that language. So I feel like a resource that can facilitate that to help arts practitioners just make that little leap will make an enormous difference from the ground upwards, I feel. That was all I wanted to say.
So just to add, that's something we're doing at the moment, Amina, is actually putting together a toolkit with shared language, with exactly that. We know it works, but we need to be able to explain why it works and how it works and who it's for. So that's actually our next step in the cultural social prescribing is toolkits. So it will be with you soon.
Fantastic, fantastic.
Amazing.
Maybe just as a short feedback. I think to bridge that, the theory for art and well-being is very, very important. And I forgot to give my background because I started with nursing. I have been a nurse for 18 years, and then I studied art history, and finally I combined two together. And to start with, why I research on art and well-being is because, you know, most people find that I'm an art lover. That's why art is so powerful, just to Sophia. But to me, no, it's not about me. Okay, so I start researching on, you know, anthropology, neuroscience, especially the visual and senses. And there's a lot about dementia and senses, language and senses. Those are very, very resourceful, you know, knowledge to support. Yeah, and also, you know, aesthetic theory, of course, clinical studies on art therapy and also psychotherapy, all those things. So and also trauma studies, okay, memory, traumatic, emotional memory. A lot of those theories are very, very good supportive, you know, ground to explain. And in the past 10 years, I think my role is as an academia to help the art facilitator to explain what's going on in that process. And then once I get it clearly explained, then the social worker suddenly plop, oh yes, it's not because you and your friend or just a collaboration. It is because art is a non-verbal language. It's all about senses, and we all have senses. And this is a very direct way, okay? So it works. And so I think we need a lot of, you know, readings and also more academia to work together. Because my expertise is not art, right? And not music. But once I see the process, I immediately understand what's going on there. Just now, like Jenny said, you know, here and now. There's a lot of theory about here and now. And once you explain that clearly, then people understand, yes, it works. It really works. And it's very, very powerful. And I think that's why we need more collaboration. And I'm really glad to hear Jenny and, you know, I mean, I think Hong Kong has still a long, long way to go. But your presentation gives me hope. Another 10 years, maybe. Hope so. Yeah.
Thank you so much, Sophia. I think one of the key words that I was picking those is about that communication, whether it's, so yeah, artists, caregivers, social workers, academics and researchers. It's all about that communication and those different languages being bridged. So Jenny, it would be really, really interesting to get that toolkit whenever it's ready. It would be really amazing if you could share that with me, and I'd be very happy to pass it on to any interested members of the audience here in Hong Kong as just one thing. But I feel as though we could go on talking for quite a bit longer, but we have already run over quite a bit, as these things often do. So thank you to everyone who is with us still and who has joined us today. We will just post details of the other workshops coming up in the chat, which I'm just doing now. But Otherwise, just a big thank you to our panelists and the creative leader from this morning in the UK and this afternoon in Hong Kong. And thank you very much to all of you, the audience, for joining us. Thank you.
Thank you.
Goodbye, Ben.
All
Thank
the
you,
best.
everyone.
Okay, thank you.
Bye-bye.
Yeah, bye-bye.
Thank you. Bye.